Doctors have read it. When was a patient right about something but you insisted they were wrong until it got serious? Patient here and nothing serious or life-threatening but irritating all the same. I have a lump on my face about the size of an acorn. It's been there for years but has been growing rather quickly over the 2 to 3 years. I'd been to see multiple doctors about it, looking for a proper diagnosis. Most of them told me it was a subcutaneous cyst, there's nothing they could do and I should just try washing my face better. Fast forward to July this year and I visit a new doctor at a completely different office, and he actually decides to see if he can release some pressure from the apparent cyst on my face. After 15 minutes of prodding, he couldn't get any more than a few drops of semi-clear fluid out of it. I have a benign tumor on my face and nobody bothered to look any deeper than the surface level to find this out. I also have another lipoma, the type of cyst I have, deep in my lymph node directly below the original lipoma. I have a plastic surgery appointment coming up sometime next year to deal with it. 3-year-old kid with gastro. Mother says the kid is floppy and weak, but during examination he was climbing furniture and doing normal kid stuff. All objectively normal as far as it's possible to do a neuro exam on an uncooperative 3-year-old. Advised to encourage fluids and small frequent meals, prescribed ondansetron and moved on cause it's a busy ed with ambulances lining up by the minute. 24 hours later he represents completely flaccid, gets intubated and flown to a tertiary center. Turns out there's a super rare autoimmune reaction to certain GI pathogens that causes demyelination similar to Guillain-Barré syndrome, and I fucking missed it. Every day there are thousands of kids that turn up to ed with gastro. Most of them are a bit flat cause they're exhausted, hungry, and dehydrated. So are the parents. I can't MRI and LP every kid who presents lethargic after a bout of gastro. The number needed to treat is far greater than the number needed to harm. Medicine is largely a numbers game. We go for the most likely diagnosis, acknowledging that sometimes we will miss the occasional unicorn. That's why we tell patients to come back if something changes or gets worse. No one knows everything about medicine, and often patients turn up before their symptoms get bad enough to match the descriptions in the textbook. It's only a matter of time before you miss something bad. If it hasn't happened to you, then you haven't seen enough patients. When it does happen to you, it will burn itself into your brain forever. It will eat at you and keep you awake at night, but the only way to keep going is to find a way to persevere and learn so you never miss it again. Accept the fact that you are going to miss something again and change your practice to reflect this fact. Caveat: not a doctor, I'm a medic. Saw 3 patients in a row who were clearly malingerers, using the military medical system to get out of work without actually being sick or injured. Patient number 4 comes in and says basically she doesn't have any other symptoms but her ears are kinda sore and she wanted time off work. I instantly thought linger number 4 then and was very dismissive. Had to run every case through a medical sergeant who asked me if I'd actually done a full assessment before dismissing her. Admitted no, and they rightfully told me off and made me go back and do my job properly. So I returned to the patient, take an actual look in her ears, and to this day they were the most messed up ear canals I've ever seen. They had the bizarre scratch/cuts running down the canals and both eardrums full of blood and swollen. I was extremely apologetic and sent her straight to the doctor for an urgent review. Taught me a valuable lesson I have never forgot about doing a full assessment on every patient, regardless of what I think about them or their symptoms. Edit: for all those asking, I have no idea what was wrong with her ears. One of the downsides of working in my area is that once you pass a patient on, you almost never hear about what happened after. My best guess is a sudden and intense infection that swelled her ear canals so fast the skin split, but it's just my guess. Patient here. I had a tumor on my foot that my PCP said was a fatty deposit that kept getting bigger because I was gaining weight. I forced the issue once I struggled to wear some shoes and it would throb and be painful if I put pressure on it. Doctor still didn't want to send me for testing because he thought I was being vain. He finally sent me to a surgeon after an ultrasound came back that it looked abnormal. The surgeon poked it, told me it was a fatty deposit and the pain was in my head. She refused to biopsy it to save me money. She removed it and then sent it out for testing. It ended up being cancer. I had 2 additional surgeries and was on bed rest for 3 months with a fucking hole in my foot because the initial surgery destroyed the integrity of the skin. I now have 2 giant scars on my foot and inner thigh, so it's a good thing I wasn't actually just being vain. The average endometriosis patient has her pain dismissed for 7 years before diagnosis. In my case, it was only diagnosed after a life-threatening complication, which developed about a quarter century after my symptoms first appeared. Patient story. Fault lays with private insurance system in Switzerland. My sister endured reoccurring excruciating abdominal pain for 2 days. Super swollen belly, pain made her puke, couldn't walk, her husband had to drag her across the apartment on a blanket to the restroom. Her insurance plan requires a phone call to determine if a doc is needed. Was dismissed, they thought she had some kind of food poisoning. When she stated extreme pain, the operator asked if she felt she was dying. Note we had a tough upbringing, leading to intense pain resistance. My mom, siblings and me are the kind to die standing, as I used to say, so my sister answered no. She thought something was wrong with her IUD. The day after, she refused to call in again and directly went to her doc. After an ultrasound, she was directly flown into hospital by helicopter. She lives in a touristic mountain place. Ambulance would have taken too long to ER, and had emergency surgery and blood transfusions. Turns out she had been bleeding out more than a liter from a ruptured tube from an ectopic pregnancy. She would not have survived the day. Patient here. One Friday I was rearranging furniture and started feeling abdominal pain. At first I figured it was a bellyache from eating junk food at an internship and tried to ignore it, but it got worse, so I lay down. Over the next few hours the pain grew much worse, so I thought, this is lower right quadrant, that's where appendicitis would be. Better get it checked out. At the local ER, the doctor poo-pooed my symptoms and sent me home with pain pills. Maybe I should have returned to the ER before I passed out from pain, but Vicodin doesn't exactly help a person think clearly. Monday morning I shuffled into the campus health clinic and they sent me to see a gynecologist, who does an exam and refers me to the ER at a women's hospital. The ER had a bunch of doctors examine me and kept me overnight for observation. I asked for a laparotomy. They poo-pooed the request and discharged me the next morning without a diagnosis. They scheduled an outpatient appointment for a follow-up ultrasound for Thursday. By Wednesday I was moving really slowly. Thursday I went in for the test and wailed in agony when they ran it. The blood-curdling scream accomplished something that none of my other efforts at communication had. Somebody realized there was an actual problem. Finally I get a laparoscopy. My request 3 days earlier had been a good call, had just asked for an older version of the diagnostic. And this go around nobody's wasting any time. When I woke up there were 11 staples holding my abdomen together. My very dead ovary had been through 3 complete rotations and had been rotting inside my abdomen for several days. If it had gone untreated much longer it would have killed me. And if any of half a dozen physicians at either of 2 hospitals had taken my report of pain seriously enough to run an ultrasound without waiting nearly a week, then they might have saved it without needing surgery. I used to be a nurse. I remember one patient I had in nursing school that was 16 years old and about 6 months pregnant. Her boyfriend was also 16. I can't remember what was wrong with her, but she was terrified because her parents kicked her out on the street as soon as they found out she was pregnant. The boy's parents kicked him out. It was winter and they had no place to stay and no food. So I did 5 minutes of research and gave them the phone number in that county where they could apply for food stamps, WIC, Section 8 or public housing, and stuff. When the nursing professor found out that I had violated Christian values by giving them info to survive, I got a demerit. I never found out what happened to those kids, but I've always hoped that they somehow got some help. This was in the Bible Belt.